And welcome back. Joining us this morning, this is our Medical Minute, and we have social worker Kristen Anderson with us and Dr. Bill Albers, the founder of the Congenital Heart Center at OSF Children's Hospital, and they're here to discuss the upcoming Congenital Heart Patient Symposium. Thank you both for coming in this morning.
Thank you.
Of course, so let's talk about what kind of issues do children born with congenital heart disease face?
Well, first of all, thank you for having us. Congenital heart disease means a heart defect that's present at birth. This is one of the most common congenital defects. Heart conditions can be mild and not require much treatment, but a third of these patients have serious life-threatening conditions which are present at birth, and without treatment, the children might not survive. Over the years, there have been major advances in the surgical and medical treatment, as well as the diagnosis of children with congenital heart disease. And now many children who wouldn't have survived 50 years ago are living to be adults, having their own families, and so on. In fact, there are more adults now with congenital heart disease than there are children. And it's important that those individuals be cared for by a team of individuals with specific training and knowledge about these defects.
Absolutely. And that kind of brings me to my next question. Why is it so important to have a congenital heart center here in Peoria?
Well, as I mentioned, it requires pretty sophisticated treatment. And I came to Peoria in 1967. And at that time, if treatment was to be had, it had to be in Chicago or St. Louis or Indianapolis or Iowa City. We were about equidistant between those cities. It's a 3-hour trip, and many children would pass away before they made that trip. As the program here has developed, we've developed our own surgical team, and now offer a full range of services for all children with these serious defects.
Well, that is wonderful. And how about parents and families? How does this impact them, and what are some of the stresses there?
Stresses can be anywhere from transportation to and from appointments. It can be unknown surgical procedures that need to happen very quickly. It can be anything as far as the financial impact of insurance and copays, and then the majority of our patients and families do suffer from some form of anxiety, depression, or post-traumatic stress disorder due to having a congenital heart defect or their loved one having a congenital heart defect.
Oh, wow. Wow. And tell us about the upcoming symposium that's happening next month, right, in February?
Yes.
February 11th.
Okay, very nice. So where and when is that happening? We have some information there on the screen, but so it's happening February 11th, 2 a.m. to 7 a.m.?
Actually, it's 8 a.m. to 1 p.m.
Okay, okay. We'll have to change it. 8 a.m. to 1 p.m.
Yes.
Okay, okay. That must have changed. I looked online on the website and
yes.
got that information from there, but I guess that has changed.
Yes.
Okay, and it's at the Jump Simulation Center?
Yes, it sure is. And it's specifically designed to talk about adult care in congenital heart defects, and what that means is, Dr. Albers has said, starting your own family, how your symptoms transition to adult care, and then resources that a social worker can provide as well.
Very nice. And how can someone register?
You can call the Congenital Heart Center at 309-655-3453, or you can go online to the Jump Simulation Center and register there.
All right, very nice. And again, it is February 11th from 8 a.m. to 1 p.m.
Correct.
Okay, awesome. All right, well, you heard it here first. Thank you both for coming in this morning.
Thank you.
Thank you for having us.
Of course, anytime. Well, we'll be right back, but of course, if you or someone you know would like to join our Community Corner, you can head to our website, 25newsnow.com, click on the Community Corner tab, go ahead and submit your form, and we hope to see you on soon. We'll be right back. Stick with us.